Breast cancer is a type of cancer that forms in the cells of the breast tissue. It is the most common cancer in women worldwide, though it can also occur in men rarely. Breast cancer occurs when cells in the breast grow uncontrollably, forming a lump or mass that may spread to other parts of the body if left untreated. Types of breast cancer. Breast cancer can be categorized based on its origin and whether it has spread beyond the breast. 1. Non-invasive, in situ. Ductal carcinoma in situ, CIS. Cancer cells are confined to the milk ducts and have not spread. Early and highly treatable. Lobular carcinoma in situ, LCIS. Abnormal cells in the milk-producing lobules, but not true cancer, increases the risk of developing invasive breast cancer. 2. Invasive. Invasive ductal carcinoma, IDC. The most common type, begins in the milk ducts and invades nearby tissue. Invasive lobular carcinoma, ILC, starts in the lobules and spreads to surrounding tissue. 3. Rare types. Triple-negative breast cancer. Lacks estrogen, progesterone, and HER2 receptors, making it harder to treat. HER2-positive breast cancer. Cancer that overproduces the HER2 protein, often more aggressive, but responsive to targeted therapies. Inflammatory breast cancer. A rare and aggressive form where the breast appears red, swollen, and inflamed. Paget's disease of the breast. Starts in the nipple and may spread to the areola. Causes and risk factors. The exact cause of breast cancer is unknown, but certain factors can increase the risk. 1. Genetic and hormonal factors. Family history of breast cancer. Inherited gene mutations, e.g., BRCA1, BRCA2. Hormonal exposure. Early menstruation before age 12 or late menopause after age 55. Hormone replacement therapy, HRT, or oral contraceptives. 2. Lifestyle factors. Obesity or being overweight, particularly after menopause. Lack of physical activity. Alcohol consumption. 3. Reproductive history. First pregnancy after age 30 or never being pregnant. Not breastfeeding. 4. Age and gender. Risk increases with age, particularly after 50. Being female. 5. Other factors. Dense breast tissue. Exposure to radiation, e.g., during cancer treatment. Symptoms. Symptoms vary, and some women may have no symptoms in the early stages. Common signs include 1. Physical changes in the breast. A lump or thickened area in the breast or underarm. Changes in breast size or shape. Nipple discharge, especially if bloody. 2. Skin changes. Redness, dimpling, or puckering of the breast skin. Orange peel texture. Scaling, flaking, or crusting around the nipple. 3. Pain. Persistent breast or nipple pain, less common. 4. Advanced symptoms. Swelling in the breast or arm. Bone pain, weight loss, or fatigue if cancer has spread. Diagnosis. Breast cancer is diagnosed using a combination of clinical exams, imaging tests, and biopsies. 1. Clinical breast exam. A doctor examines the breasts for lumps, skin changes, or abnormalities. 2. Imaging tests. Mammogram, X-ray of the breast to detect abnormalities. Ultrasound, identifies whether a lump is solid or fluid-filled. MRI, provides detailed images for high-risk patients or unclear cases. 3. Biopsy. A sample of breast tissue is taken for laboratory analysis to confirm cancer and determine its type. 4. Hormone receptor and HER2 testing. Determines whether the cancer is hormone-sensitive or HER2 positive, guiding treatment decisions. 5. Staging tests. CT scans, bone scans, or PET scans to determine if the cancer has spread. Stages of breast cancer. Breast cancer is staged from 0 to 4 based on its size, spread, and lymph node involvement. Stage 0, non-invasive, localized, e.g., CIS. Stage I, small tumor, localized, minimal lymph node involvement. Stage 2, larger tumor or limited lymph node involvement. Stage 3, extensive lymph node involvement or tumor spreading to nearby tissue. Stage 4, cancer has spread, metastasized, to distant organs, e.g., bones, liver, lungs. Treatment. Treatment depends on the stage, type, and hormone receptor status of the cancer. Options include 1. Surgery. Lumpectomy, removal of the tumor and some surrounding tissue. Mastectomy, removal of one or both breasts. Lymph node surgery, sentinel lymph node biopsy or removal of lymph nodes to check for cancer spread. 2. Radiation therapy. High-energy rays to destroy cancer cells, often used after surgery to reduce recurrence risk. 3. Chemotherapy. Drugs to kill cancer cells or shrink tumors before surgery. 4. Hormone therapy. Used for hormone receptor-positive cancers to block hormones like estrogen or progesterone. Examples: tamoxifen or aromatase inhibitors. 5. Targeted therapy. Targets specific proteins, such as HER2. Examples: trastuzumab, Herceptin, pertuzumab. 6. Immunotherapy. Boosts the immune system to fight cancer, particularly in triple-negative breast cancer. Prognosis. Early detection improves survival rates significantly. 5-year survival rates. Nearly 99% for localized breast cancer, stage I. Lower for advanced or metastatic cancer, but improving with new treatments. Prevention and risk reduction. Regular breast screenings, mammograms, and self-exams for early detection. Healthy lifestyle. Maintain a healthy weight, exercise regularly, and limit alcohol. Preventive surgery. For high-risk individuals, e.g., BRCA mutation carriers, prophylactic mastectomy or oophorectomy may reduce risk. Medication. Tamoxifen or raloxifene for high-risk women. Support for women with breast cancer. Emotional and psychological support is essential. Support groups, counseling, and cancer organizations, e.g., Breast Cancer Now, Susan G. Komen, provide resources, information, and guidance. Early detection, advances in treatment, and awareness campaigns have significantly improved outcomes for women with breast cancer.